Okay. So my name is Lisbet Charana, as Dr. Mbao has said, and I'll do a short presentation on MYDAWA as one of the newer ways of offering our services as pharmacists in the industry. So MYDAWA is pegged on technology and innovation, health innovation. So as things change, digital health innovation is becoming very important in order for all the population to receive good health. And I know we've all seen this with the COVID pandemic, where it became important for people to be able to access services from wherever they are, when movement is restricted. So basically, the point of the innovation is, again, as I've said, to increase access to health services. This by allowing all the doctors and all other medical practitioners and pharmacists as well to give patients access to whether it's consultation or health products from wherever they are. And as the space is growing, it's still quite new, but we know that there are a lot of doctors giving online consultations, telehealth. E-health is a growing area. So for any e-health platform, the most important thing is patient safety, making sure that the patient is well taken care of and they're not endangered in any way, and giving them and having following good practices. So in terms of the challenge or the space that we're trying to fill, e-health is not necessarily the one answer, but it is a piece of the puzzle. So we know that we are experiencing about 274 deaths daily in Africa due to lack of access. And as pharmacists or pharmacy professionals, we know that we have either counterfeit or substandard medication in our market, and up to 30% is what the data says for now. Some of the challenges that we are facing, or that our population faces, is the cost of medication, the high cost of medication, low access. The low access maybe in terms of the distance to a pharmacy, or even getting the medicine in stock. So that's the part for stockout challenges. I think many speakers before me have talked about the stockouts that we experience in our sector. And then sometimes the supply chain is fragmented. And we know that we have an increase in lifestyle diseases, the diabetes, hypertension, and all these other chronic diseases that have come in are a challenge that is there. And because of this, there's people who are consistently on medicine, and adherence to the medication is becoming more and more important. So this is where we fit into the puzzle. And this, the presentation shows MYDAWA, but this refers to any e-health platform. So basically trying to reduce the cost and giving a better quality of care and medication. So as MYDAWA, who is MYDAWA? MYDAWA is an e-commerce solution. So it's a pharmacy that is registered by the Pharmacy and Poisons Board. This happened in 2018. It was the first pharmacy to get a retail license. So we sell, of course, we offer medicines and other health and wellness products and personal care products as well. So we try to connect the prescribers, insurers, and patients to products. So we have, when I talk about prescribers, there's the brick and mortar hospitals, and we also have telehealth healthcare providers. We have insurers on board, so we connect their patients who are under the insurance schemes and patients who come to our platform directly. So we use technology to make sure that the service that we are offering is efficient and it's of high quality. So the point of all our activities is to benefit the patient. So we try to be as patient-centered as possible. So that's, again, quality and affordability to the medicine. So in terms of the supply chain, we use technology to go as high up the supply chain as we can. So the reason for this is to make sure that we are getting as the product as close to the source as possible. That way, we've reduced the possibility of substandard or counterfeit infiltrating products that could have infiltrated the supply chain. The other reason, obviously, is to reduce cost, because as the products move from the manufacturer to the importer, let's say to the distributor, wholesaler, retailer, there's a cost implication in each of these steps. So for the product as high, if you go, let's say if you're able to get it directly from the manufacturer, for example, it's going to be cheaper to the client eventually. So it's in terms of financing, at least the last mile, we try to reduce the cost to the at the last mile to the user of the product. Because the business is online, it's transparent. It's clear to see what products we have, the pricing and all that. And this is, the patient can be confident about what they're getting from us, from our platform or other e-health platforms. So the brand as MYDAWA is built on 4 pillars. So the first one is quality. So for quality, we ensure that we're giving good quality products by making sure that we are only purchasing from suppliers that are registered, number 1, by the PPD, or are the authorized importers or distributors of the product. The other thing we do about this, with this, is that we will attach, I will talk about that a bit later. So we build our brand on quality, on convenience. I think we all understand that ordering online, the main benefit is convenience. So once you purchase online, it will be delivered to your doorstep or to wherever you choose to have it, quickly and securely. In terms of privacy, the products are delivered in a sealed package, and your data is private. For the pillar on privacy, I know we've seen an uptick, especially of sexual and wellness products, such as HIV test kits, so that people might feel embarrassed to walk into a normal brick and mortar pharmacy and buy some of these products, but they are comfortable ordering it online. So this, of course, helps with sexual health and prevention of some of the conditions that can arise from sexual, I lack the word. The last pillar is affordability to the patient, because we are able to go as high up the supply chain as possible. We try and get the best prices we can for the products that we supply, and we extend the same to the user. So this is about quality. Basically, we've all used online services, I think, for different various things. And I know some of the experiences we have are where we get the wrong product, or whatever, when the product comes, it's of a very poor quality, or there are errors. So we try to make sure that we keep things to the highest quality. And this slide just shows what can give you confidence, or the user confidence that we're maintaining high quality. Number 1, we're licensed by the PPD. Number 2, we're certified by Legit Script. Legit Script is a certification for online businesses, including pharmacies and other healthcare businesses, that they're adhering to the standards that are expected of them. We will offer our expertise because we have qualified pharmaceutical staff, so to handle all the prescriptions. And then we do a product authentication. So what we do is, when we receive a product, we attach our own QR code. And once the user buys the product is the QR code is activated. So when somebody receives the product, they can scratch, and when they send the code, it will be verified to them that the product is actually from MYDAWA and not from anywhere else, and that the product is the product that was meant for them. It was sent to them directly. So that also makes sure that the patient is confident in the product that they're getting. As for warehouse, we have, again, the operations are run under a pharmacist, qualified and registered. So for the technology is helping us make sure that we're using medicine responsibly. We're very transparent in our pricing and prescription dispensing. We have one of the things that we do is give information, patient education on our website. For example, there'll be a blog which will talk about different conditions and all that. So patients are able to come and access information. We adhere to data security standards and data protection law. We have customer authentication systems that I've already talked about. Since the company's technology, they're using technology, we are able to get a lot of data on consumer and patient feedback, and we use this to improve the experience. This is a lot more just what I've already spoken about. Maybe just to touch on our partnerships, we have our partnerships with the telemedicine providers, so that when we get a patient, for example, that does not have a prescription and they want to purchase a prescription product, we can refer them to the other telehealth partners for them to get a proper consultation with a healthcare provider who's registered, and then get the prescription they need if they need a prescription before we're able to service it. We also have a support desk that's available Monday to Sunday, 365 days a year, and there's always a pharmacy team that are always on duty to deal with anything pharmaceutical. So on this slide, how to order from MYDAWA, you create an account, you upload a photo of your prescription. So this is where we have the pharmacy team come in. The pharmacy team, there's actually a physical person who sits, who's a pharmacy professional registered by the PPB and licensed to practice. They go through the prescription, check for validity. Once the prescription is confirmed as valid, and there are no contraindications and the normal things that we check for in a prescription, they will then transcribe the prescription. Once they transcribe the prescription, the client will be informed, and they'll transcribe the prescription and upload the items onto the client's cart. When they've done that, the client will now be told they can check out their cart. They cannot alter the products that are in the cart. They cannot add, they cannot remove. Then they just pay for what, and it's checked out, where now the prescription goes to be processed in the warehouse. In the warehouse, we have, again, a pharmacy team that will deal with the prescription, process it and pack it, and hand it over for delivery. Delivery to the client will be done either by a pharmacy professional, or where the products are, let's say, over the counter, they will have a call from the pharmacy professionals in-house to offer patient counseling in terms of how to use the medication, what side effects to expect, if any, and just to let them know they can always call back with any inquiries or challenges that they're facing. So this is about just being able to be reached at between 8 a.m. and 10 p.m. There's always, again, pharmacy professionals confirming to assist in that area. That's the end of my presentation. Thank you. And I welcome any questions.